How does scotoma affect your vision? Imagine looking at the world and suddenly noticing a dark spot or a shimmering patch that wasn't there before. That's what a scotoma can feel like. A scotoma is a spot in your visual field where your vision is partially or completely lost. It can appear as a dark area, a blurry patch, or even a shimmering or sparkling zone. The size and location of a scotoma determine how much it impacts your sight. If it affects the central part of your vision, it can make it hard to see fine details, read, recognize faces, or do tasks that need sharp eyesight. This kind of scotoma is especially troublesome because it directly blocks your line of sight and makes everyday activities more difficult. There are other types too. A paracentral scotoma happens just off to the side of your central vision. It can cause trouble seeing objects that are slightly off-center and might lead to tunnel vision if your peripheral vision is also affected. This type is often linked to conditions like glaucoma, which damages the optic nerve. Then there are scintillating scotomas, which are temporary and often linked to migraines. These look like flickering or sparkling spots that can grow and move across your visual field. They usually come with a headache and nausea but do not cause permanent vision loss. People with scotomas might notice several symptoms. These include blind spots or missing areas in their vision, difficulty seeing colors or fine details, blurred or distorted sight, floaters or small dots drifting in their field of view, and sometimes headaches or migraines, especially if they experience scintillating spots. From a brain health perspective, scotomas can be a sign of more serious issues. They might indicate damage or pressure on the optic nerve or visual pathways in the brain. For example, tumors at the junction where the optic nerves cross can cause a specific type of visual field loss called a junctional scotoma, affecting both eyes. Recognizing these symptoms early is important because they can be clues to underlying neurological problems, including brain tumors. If you notice a new blind spot or changes in your vision, it's essential to see a healthcare professional promptly. They can evaluate whether the cause is an eye condition or something more serious like a brain tumor. Early diagnosis can make a big difference in managing the underlying issue and protecting your overall brain health. In summary, a scotoma affects your vision by creating blind spots or areas where your sight is impaired. These visual changes can be caused by eye diseases or neurological conditions, including brain tumors. Paying attention to these symptoms and seeking medical advice helps ensure any underlying problems are identified and treated early, supporting your long-term brain and eye health.